A family in Saskatoon is facing a huge hospital bill after a grandmother visiting from the Philippines became ill with COVID-19. She arrived before the pandemic and she had travel insurance, but she is still left owing hundreds of thousands of dollars. Bonnie Allen explains why.
69-year-old Narcisa Carranza is finally recovering from COVID-19 after more than a month in a Saskatoon hospital. Her daughter and son-in-law say Carranza feels pressure to leave the hospital. Her medical bill at last count, more than $357,000 and climbing.
Now that my mother-in-law is awake, she always wanted to go home soon.
Because she's worried.
Because she knows that there's a bill that needs to be paid. So we just told him like, yeah, we got it.
Happy birthday to you.
This family video shows happier times. Carranza and her husband arrived in Saskatoon from the Philippines in 2019 to visit their daughter's family. They had a flight home, but then the pandemic hit. So they stayed in Canada on a tourist visa. Their daughter Raquel and her husband June were expecting a third child, so the grandparents decided to stay long enough to see their new grandbaby. They were finally slated to fly home on April 22nd. But in March, the entire family contracted COVID-19. Carranza spent 17 days in the ICU.
She has to go into the ICU, so we're all scared and we don't know what to do.
Carranza's travel insurance covered up to $50,000, but it also expired on April 22nd when she was supposed to fly home. The health ministry says uninsured visitors will receive care but must be charged for services.
First and foremost, where care is needed, care is provided. They will continue to work with the individual to come to some type of resolution on it. So to say the government is not working with this individual would be, I feel, would be incorrect.
The hospital bill now so high.
It's more than a mortgage, the cost now.
June and Raquel SC are pleading for a financial break on compassionate grounds. Bonnie Allen, CBC News, Regina.